Okay. Hi guys, welcome. I'm Dr. Ali Marty, physical therapist and president with Mobile Physical Therapy. Today I have with me Dr. Shoshana Izkhakov with Summerlin Pelvic and Physical Therapy. This month for National Physical Therapy Month, I want to raise a little bit more awareness about what physical therapy is and the different types of treatments and diagnoses that you can go see a physical therapist for. So Dr. Izkhakov does pelvic health with women and men, and she owns a clinic here in Summerlin in Las Vegas, Nevada. And so I wanted to invite her on to give us a little bit more information about what she does, who she is, and everything that entails. So hi, Shoshana.
Thank you for having me today.
Absolutely. So tell me a little bit about you, where you're from, who you treat, why you treat, all that good stuff.
So I moved to Vegas about 4 years ago from Buffalo, New York, and I've been a physical therapist for about 12 years now. And I started out in physical therapy with strong orthopedics, and I got my orthopedic certification specialty in 2013. But then I kind of had an interesting case fall in my lap in 2014 where a patient reached out to try pelvic health when nobody would take her in the area. And we tried some treatment for her pain with intercourse after she had a baby. And it was enlightening and amazing satisfaction that came from helping that lady. And it kind of pushed me into the field of pelvic health. And I've been doing it since.
That's great. So why do you think that she was having such a hard time finding someone who could treat her? Are there not many physical therapists that do the pelvic health?
There aren't. It's actually a huge deficit, I think, in the pelvic floor rehabilitation throughout the United States. There's only few people that are willing to give it a try. Mostly, I think people are afraid of delving into that area because it's uncomfortable in terms of having these conversations with people. People shy away from it, are afraid to try it. But I think it's such an important aspect of health and wellness that people that have pelvic floor dysfunction have to live with day in and day out, that it has to be addressed. And people that have pelvic health issues or any kind of dysfunction have to live with that on a daily basis, and it affects their well-being, their mental and physical well-being. And I wish there were more practitioners out there that are willing to take a chance and delve into a specialty to help that patient population.
Well, absolutely, because I mean, there's such sensitive topics that, I mean, they're such important topics, but sensitive topics. I mean, we're told from however old, 3-4 years old, we don't talk about our no-no zones, and we don't talk about the parts that are covered by a bathing suit. And then here we are, however many thousands or millions of people have these problems, and everybody says, well, don't talk about it anymore. And then they just have to live with it. And it's great that you can add your specialization to help them.
Thank you. It's very gratifying being able to help people that have these kinds of issues because they are afraid. A lot of people think that it's normal, and it's not. It may be common, but it's not normal. And there is a way to treat it, manage it, and take strides towards a happier, healthier, more functional life.
Yeah, and you already mentioned one diagnosis, pain with intercourse especially after having a baby, that I'm sure many women think, oh, well, I had a baby, things are irritated down there, it's going to hurt. Are there other diagnoses that you see where people are like, oh, yeah, this is totally normal and I just need to live with it?
Yeah, so another common thing we see usually with women that have had babies is incontinence, urinary leakage, fecal incontinence, stool leakage. And that's another thing I hear quite commonly. Well, that's okay, I had a baby. So yes, it's common, and part of the side effects of having a baby, but staying with urinary incontinence or leakage or urgency after having kids, after your body has done healing, is not normal. And she can absolutely improve that quality of life as she continues with her recovery and getting ready for future kids, or just getting back to a previous life in terms of exercise, functional abilities, and recreational activities that she'd like to do.
Yeah. So are these types of, like, what kinds of symptoms, which is this the type of thing where somebody says, oh, don't make me laugh because I'm going to pee? Is that like the type of thing that somebody would come to you for? What are some things that she might
That's one
do?
of the more common things. Absolutely. Any leakage that is not at an appropriate time or place is not normal. So any kind of urine, loss of urine with sneezing, coughing, laughing during intercourse, with activity, when we are getting up and down from a chair or reaching or lifting something heavy, that would all contribute to pelvic floor weakness, and definitely can be improved with physical therapy. Some of the other things that we can see is more of a pelvic organ prolapse. Sometimes women will say, I feel something is like sitting there and it shouldn't be there. That would entail a little bit of pelvic health treatments to engage and strengthen the lumbopelvic girdle to help with pelvic organ prolapse. Some of the other things we see is actually people with chronic constipation and pelvic outlet dysfunction that causes them to have difficulty emptying their bowels, having abdominal pain, bloating, and that stems from muscles not doing what they need to be doing, because our GI system, our sexual system, our urinary system are all controlled by the pelvic floor musculature. So any small abnormality there can definitely trickle into bigger issues that people will have down the line. Actually experience chronic pelvic pain, and we've had some great success treating that here.
Great. That's awesome. And you mentioned things like chronic constipation and pelvic floor dysfunction and things like that. So another thing that I didn't know until you had told me, that actually somebody who passes gas uncontrollably, like when they get up from a chair or they're doing exercise, that can be a symptom as well. And that's not normal, and that can be helped. Am I remembering that correctly?
That's absolutely correct. Yes. The passing of gas is also controlled by our internal external sphincters, which are controlled by our pelvic floor. Absolutely.
Okay. Are there other conditions, or actually a better question is, if somebody has these symptoms, how do they get treatment? Do they need to go to their primary care physician first? Do they need to go to a urologist or anything like that? How can somebody come see you?
The best way is to really just give us a call. A lot of patients that have had these symptoms chronically have had already some kind of workup, either by their primary physician, or they've seen a specialist, urology or GI or colorectal surgery. So we would be able to get a referral from their physician if needed. We do have people just reaching out by themselves and asking, I have this and this, is it something you can help me with? And if it is, and most likely it is, then we will be able to help them navigate either the insurance or the referral process to be able to get them some help.
Great. Now, what if somebody has already tried, they say, oh, I've tried everything, like I'm a lost cause. I shouldn't even bother.
Those are my favorite patients because it's never a lost cause. No, that's never a lost cause. I don't think I've ever said to anybody that I can't help you. We may not fix them 100%, but we'll definitely do our best to get them some improvement enough to have a relief to be able to be functional, and we'll definitely keep trying things until we get to the right treatment protocol for patients. A lot of time, our approach is a little bit different. We look beyond just the pelvic muscles. You have to look at the girdle above and below, because our body is a dynamic moving unit. So the exam that we do is definitely more thorough. Our evaluation is a lot more thorough, and their treatments may involve a lot of aspects and not just massage or internal work. A lot of our patients require a lot of relaxation techniques, and we work on diaphragmatic breathing, because if our central nervous system is hypersensitive, we can do all the exercises in the world. Until we get that under control, we won't progress. So it's a process. I think people that want to try pelvic floor rehab for any decides to take on pelvic floor therapy, and it's like that with really any form of therapy. You have to be patient. You have to put in the time. Give it a good try. A couple of visits is not a good try, because our body is very dynamic. It takes time to change, and we have to keep persuading it consistently until we see results. So, you need to put in the time. You need to give body time. Be consistent. Work with your providers and do your homework.
So you're saying that people aren't cured overnight with physical therapy? Am I hearing
No,
that?
no.
Never. I
we
never
have
would
we
thought
have some
that.
we have some miracles that have happened, but those are far and few in between, and that's usually when issues are acute and it just happened recently, and we.
Good. Thank you. It definitely does take time for physical therapy. And so you mentioned many treatments that women can have. Do you ever treat any men?
Yes, we do we see quite a bit of men for pelvic floor dysfunction. Usually for men, some of the more common issues that we see them for is chronic pelvic pain and outlet dysfunction, constipation. For incontinence, usually the men we see are post-op for radical prostatectomies or any other surgeries for cancer or TURP surgeries, things like that. So we do see some incontinence, but I would say the most common diagnosis that we see men for is the chronic pelvic pain.
Okay, great. What is something that you wish just the general public knew about pelvic health physical therapy? And it could be something that maybe you already said, but I think something like that is important to repeat or something new.
Absolutely. I think my biggest thing, and I always say to patients, is the fact that something is common, it doesn't mean that it's normal. And the fact that people have had these symptoms for a long time doesn't mean that there's no hope of getting it better. So if people think that, well, it's okay, I'll live with it. No, because the longer we let things like incontinence go on into adulthood, into the elderly, that puts people at risk for falls, for other comorbidities. It has a higher chance of hospitalizations, UTIs. It puts an extra expense on leak protection garments and so forth. So if you have those symptoms, just better be safe, be on top of it, try some more preventative. This is not something people have to live with. There's a way out, there's hope, and give this a try.
Great, thank you. So to be able to give you a try, could you share ways that patients could reach out to you, maybe your address, phone number, how
Sure.
to contact you?
Yes, we're located in Sun City in Summerlin. Our address is 9414 Del Webb Boulevard. Our phone number is 702-331-1654. And you can reach us by email at therapy@summerlinppd.com, or you can visit our website, summerlinppd.com. We have great reviews on Google, and some of the patients that leave their reviews actually tell a little story about how they felt when they came in and how it helped them. And I hope that inspires people to see that there is a light at the end of the tunnel, and there is hope for everybody to recover from these pelvic floor issues. So give us a call, reach out either on our website or email us. We do have a page on Facebook and Yelp. So there are lots of ways to get in touch. We're very friendly, and we'll do the best we can to get you some help.
Well, great. I think all of that's great information. Thank you so much for sharing with us.
Thank you for having me.